Drugatosh Pandey, and I am the head of surgical oncology and Oncology Sciences in Manipal Hospital Gurugram as well as in Dwarka. Today I want to discuss about the pancreatic cancer, its presentation and its management. Pancreatic cancer is one of the aggressive cancers in the human body, and to many it is a very deadly cancer. It occurs in the pancreas, which is endocrine as well as an exocrine gland in the body. It is situated deep into the abdomen, the central part of the abdomen. The most important presentation of pancreatic cancer is jaundice, and this jaundice is obstructive in nature, which means that this tumor compresses upon the bile duct and therefore does not allow the bile to come to the intestine, and this causes jaundice. Once it is discovered, there are a series of investigations that are done in order to get to a diagnosis as well as to an accurate stage of that disease. The most important methods of diagnosis would be an ultrasound of the abdomen, a contrast enhanced CT scan or a PET scan, and sometimes an endoscopy and an ERCP. If the jaundice is too high, it might be preferable to reduce the jaundice before we go in for a surgical treatment of a pancreatic cancer. Among the surgical treatment, the most important step of the surgery would be to rule out any presence of any distant metastasis, which means whether the cancer has spread to the other parts of the body, including the liver and peritoneum. If it has not spread, then this tumor is resectable and potentially curable. And the surgery that we do is called an Whipple's operation, which involves removal of a part of pancreas, a part of bile duct and gallbladder, and a part of stomach and intestine. Once this whole thing is removed, then the reconstruction phase starts, in which we reconstruct all those things: the bile duct to the intestine, the pancreatic duct to the intestine, and the stomach to the intestine, so that the passage of food and the bile can be restored. This is a complicated procedure, and it involves a fair degree of morbidity as well. With the advanced techniques, the chances of complications have really reduced. The mortality of this procedure, the risk to life that we call, has also reduced quite dramatically. And today these procedures can be performed with very much quite a degree of safety, and these patients can be cured of the disease. The surgery itself is not the end of the thing. After the surgery, the entire specimen is sent for the pathology report in the laboratory, and depending on the pathology, the patient may or may not require a further chemotherapy. Properly done and treated, these patients can lead a normal life and can be expected to be cured of the disease. Thank you.